north for 10 kilometers.
Still lands right on the handlebars.
That's kind of hard. And yeah, that kind of direct blow to the abdomen, that's always risky, especially for the kid.
And here's the thing, unlike our first case, there's no blood, no open wound, just a little guy complaining of a tummy. Easy to brush off, right?
Not so bad. External injuries, they can be scary looking, but they don't always tell the whole story. We're talking about packed space full of vital organs. With Henry, no obvious trauma makes it even trickier to figure out.
So, what were the paramedics looking for in the signs?
Well, Henry's symptoms were subtle, but they were definitely cause for concern. He had abdominal pain, and it was getting worse. His abdomen was distended, meaning swollen, and it felt firm to the touch. When they gently pressed on his belly.
Pain on palpation. What does that actually tell us? I mean, any bruise hurt pretty fast, right?
Sure, but in this case, pain on palpation, it suggests there's inflammation or even injury to the organs inside. Think of it like this: pressing on a sore muscle versus pressing on a broken bone. Different kind of pain, right? Tells you something different is happening.
So even though we can't see an injury, these signs are telling the paramedics that something could be seriously wrong inside.
Exactly. And this is where knowing the differences between kids and adults is so important. The textbook really hammers
Figure
this
out what
home.
they want me to do.
What do you mean by pediatric differences? Do children experience abdominal injuries differently than adults?
In a lot of ways, yes. Children's organs, they're bigger proportionally, and they're closer together. So, more likely to be injured by blunt force. Imagine trying to fit the same number of puzzle pieces into a smaller box. Less room for error.
Yeah.
And their abdominal muscles, they're not as developed, so less protection.
So a fall that might just bruise an adult could actually cause some serious internal damage to the child.
Exactly. And kids, they can't always explain their pain as well as adults. So paramedics have to be even more careful in their assessments, relying on those subtle clues to guide their decisions.
It sounds like a real challenge, like solving a puzzle with some pieces missing.
That's a great way to put it. Now, in Henry's case, his abdomen wasn't just distended, it was also firm. And that's a big deal because it suggests internal bleeding.
So even though we can't see blood, the paramedics are using these clues, like the firmness of the abdomen, to try and figure out what's happening inside.
Exactly. And that's why it's so important for paramedics to really understand anatomy and physiology, the mechanisms of injury. They need to be able to connect the dots, even when those dots are, well, subtle or hidden.
Okay, so we've seen two very different cases of abdominal trauma. A stabbing with a clear external injury and a bike accident with no visible wounds at all. What's the connection here? What's the clue? It seems like early recognition is key in both cases.
Oh, absolutely. Stabbing, handlebar injury, doesn't matter.
Yeah.
Recognizing the possibility of internal bleeding, acting fast, that's what makes the difference in abdominal trauma.
Because the sooner they can do something, the better the outcome.
Exactly. Untreated abdominal trauma. That can lead to all sorts of long-term problems: organ damage, infection, even death.
Right, so this is serious stuff. It's not just about patching someone up and sending them home. These are potentially life-saving interventions.
You got it. And, we've been focusing on paramedics. These lessons apply to everyone. Knowing the signs of abdominal trauma, it can help you make better decisions in an emergency, even if it's just knowing when to call for help.
That's a good point. Even without medical training, we can still make a difference. Now, there was something in the textbook that really caught my eye. It said that kids are more prone to splenic injuries than adults. The spleen, that organ tucked up under the ribs, apparently it's pretty vulnerable, especially in kids. Any idea why that is? What makes their spleens so susceptible?
That's a great question. It's what we always say here on the Deep Dive: stay curious. The textbook gives us the basics, but it doesn't always tell us why. And that's where the real learning happens.
So you're throwing down a challenge for our listeners, I like it.
Exactly. Think about what we learned about kids' anatomy. Their organs are bigger, proportionally closer together, and those abdominal muscles, not as strong, not as much protection. Do those things play a role in the spleen's vulnerability? It's a fascinating question. I bet our listeners have some great ideas.
Maybe we'll even bring it up in a future deep dive. Share some of those listener theories. Who knows? But for now, I think we've given everyone a solid understanding of abdominal trauma. They've got the knowledge, they're asking the right questions, and they're ready for whatever comes their way, whether it's a medical emergency or just a better understanding of how their bodies work.
Couldn't have said it better myself. That's what the Deep Dive is all about. Taking complex information, breaking it down, making it fun and engaging, giving our listeners knowledge they can use in their lives.
And this is just the beginning. We've got tons of exciting deep dives planned. We'll be exploring everything from the human brain to the latest in space exploration.
So stay curious, keep exploring, and join us next time as we take on another fascinating topic.
Until then, happy diving, everyone. Welcome to the deep dive. Today, we're going behind the scenes of emergency medicine.
Oh, okay.
Yeah, exploring the world of behavioral disorders from a paramedic's perspective.
Interesting.
We've got some fascinating case studies and test questions
Oh, wow.
taken straight from a paramedic textbook. The kind of stuff that really makes you think.
Yeah, these aren't just abstract medical scenarios.
Right.
We're talking about real life situations that paramedics encounter every day.
Yeah.
Situations where understanding human behavior can be just as crucial as knowing medical procedures.
Exactly. And you'll see how the lines can blur when it comes to behavioral emergencies.
For sure.
We're gonna delve into cases involving potential suicide. Okay, extreme agitation.
Yeah.
Even situations where restraint becomes necessary.
Restraint. Yeah, that's always a tough one.
That is.
What's fascinating is that each case presents unique challenges, ethical dilemmas,
Right.
and opportunities to learn.
Yeah.
It's about more than just treating symptoms. It's about understanding the whole person in crisis.
Yeah, let's start with a case that really highlights the complexities of scene assessment.
Okay.
Imagine this.
Okay.
A 16-year-old boy
Okay.
found by his father.
In 600 meters, turn right onto Little Current Road, Ontario 540 East.
He's unconscious. His skin is turning blue,
Oh, wow.
and there are fluids on his chest and abdomen.
Oh, my God.
The father, who's already started CPR, tells the paramedics he found his son with padding under the tie around his neck.
That detail about the padding, it immediately raises questions, doesn't it?
It does.
In a situation that seems like a clear-cut suicide.
Turn right onto Little Current
that
Road,
one
Ontario
detail
540
throws
East.
everything into question.
It does, and it forces paramedics to consider a difficult possibility:
Okay.
autoerotic asphyxiation.
Oh.
It's a phenomenon where individuals accidentally die during solitary sexual acts.
Continue on Ontario 540 East for 30 kilometers.
Wow.
The presence of padding suggests this might be the case rather than a deliberate attempt to end his life.
That's such a sensitive and often misunderstood topic.
Yeah.
I imagine it takes a lot of training and experience for paramedics to even consider that possibility,
It does.
especially in the midst of such a charged situation.
It does, and they have to balance their investigation with incredible sensitivity towards the grieving father.
Right.
Can you imagine the guilt and confusion he must be
I
experiencing?
can't even imagine.
Paramedics need to be careful not to add to that burden by jumping to conclusions.
Absolutely. It's about gathering all the information,
Yeah.
considering every angle, but
Yeah.
also treating everyone involved with compassion and respect.
Right now, in this case, they learned the boy had a history of asthma
Okay.
and was on medication.
Okay, so that adds another...
That adds another layer of complexity.
Could an asthma attack have somehow mimicked the symptoms of hanging?
Yeah, it's a question that highlights the importance of differential diagnosis.
That's where paramedics have to become medical detectives,
Yeah.
right? They have to look beyond the most obvious explanation and consider all the potential factors at play.
Precisely. They have to connect the dots considering the boy's medical history,
Uh-huh.
the specific details of the scene,
Yeah.
and all the possible explanations for his condition.
And in this case, they also had the boy's ECG readings to consider.
Right.
Initially, it showed pulseless electrical activity,
Oh,
or PEA.
PEA.
Can you explain what that means for those of us who aren't medical professionals?
Sure, think of it this way. His heart was essentially quivering,
Okay.
not pumping blood effectively.
Wow.
It's a very serious condition.
Yeah.
Later, his ECG progressed to a systole,
Okay.
which is essentially a flat line,
Right.
no electrical activity at all.
So they're dealing with a young patient, a potential hanging,
Right.
a distraught father,
Yeah.
and a complex medical situation all at the same time.
Yeah.
It really emphasizes the weight of responsibility these paramedics carry.
It does. And that was just our first case.
Oh my gosh.
Ready to move on to a scenario that's completely different.
Absolutely. What do we have next?
This time we're called to a scene where police have restrained a 48-year-old man who is manic and aggressive.
Okay.
He's exhibiting erratic behavior, struggling against the restraints,
Oh, wow.
and lashing out verbally at anyone who comes near.
That sounds incredibly intense, even dangerous.
Yeah.
I can only imagine how challenging it is for paramedics to approach a scene like that. that.
It is, and it presents a whole different set of challenges compared to our first case.
Right.
When a patient is already restrained by police, paramedics have to be extremely cautious.
Yeah.
The risk of injury is high,
Yeah.
both for the patient and the responders.
Right, because you're walking into a situation that's already highly charged.
Yeah,
De-escalation must become the top priority.
it is. But at the same time, paramedics need to quickly assess the situation
Okay.
and determine the root cause of the behavior.
Right.
Is it stemming from a medical condition, a psychiatric condition,
Yeah.
or a combination of both?
It's like trying to solve a puzzle while also managing a potentially volatile situation.
Yeah,
What was this man's background? Do they know anything about his medical history?
they did. He had a known history of bipolar disorder
Okay.
and was on medication.
So, judging by his behavior,
Yeah,
it seems likely he was in a manic state at that moment.
it seems that way.
Is there a way for paramedics to confirm that suspicion quickly,
Yeah.
even in such a chaotic environment?
There are certain physical signs that can point to mania.
Okay.
In this case, his vital signs were telling.
Okay.
Elevated blood pressure
Uh-huh.
and rapid pulse indicated a heightened state of arousal.
Okay.
His dilated pupils and sweaty skin were further signs of his agitated state.
So even in a situation where the patient isn't communicating clearly,
Right.
their body is sending signals that paramedics can interpret.
Exactly. It's about being attuned to those subtle cues, reading the situation,
Yeah.
and responding appropriately.
So how did they approach treating him? What's the best course of action when you're dealing with a patient who's already restrained
Yeah.
and exhibiting such extreme behavior?
The restraints were already in place,
Okay.
which helps ensure everyone's safety.
Mm-hmm.
But verbal de-escalation techniques are also crucial in these situations.
Okay.
Speaking calmly, validating the patient's feelings, and explaining what's happening can go a long way in reducing agitation.
It's almost like a delicate dance, isn't it?
It is.
Balancing the need for control with the need for compassion.
It is. And in some cases, medication might be necessary to help calm the patient down.
Okay.
But it's not a decision to be taken lightly.
Right, because you have to weigh the potential benefits against the potential side effects and the patient's right to autonomy.
Exactly. It's a complex ethical dilemma that paramedics often have to grapple with in the field.
Now, before we move on to our final case for today,
Okay.
I want to touch on something you mentioned earlier, the cyclical nature of bipolar disorder. What does that mean for paramedics who might encounter the same patient again in the future?
That's a great question. It's important to remember that bipolar disorder isn't a static condition.
Okay.
Even if this patient is stabilized and seems cooperative now, he could experience another manic episode or swing into a deep depression down the road.
So it's not just about addressing the immediate crisis, but also understanding the long-term trajectory of the illness
Right.
and the ongoing challenges the patient might face.
Exactly. It's about seeing the patient as a whole person, not just a collection of symptoms.
With that in mind,
Yeah.
let's delve into our final case.
Okay.
One that raises some serious questions about the way individuals with behavioral disorders are sometimes handled.
Okay.
We're talking about a 34-year-old man who was subdued by police after acting bizarrely and aggressively.
Okay.
When paramedics arrive,
Yeah.
he's unconscious, has abrasions, and his skin is showing signs of cyanosis,
Oh.
that bluish tint that indicates a lack of oxygen.
This case is particularly tragic because it highlights the potential for harm when restraint practices are misused or misunderstood.
Yeah.
The fact that this man was found lying face down immediately raises red flags.
Because that position can restrict breathing
Exactly.
and potentially lead to positional asphyxia,
Yes.
which can be fatal.
Exactly. It's a risk that paramedics are acutely aware of,
Right.
especially when dealing with patients who have been restrained. Unfortunately, there's a dark history associated with restraining people face down,
Okay.
particularly a practice called hog tying,
Right?
which thankfully is avoided in modern emergency medicine due to its extreme dangers.
It's disturbing to think that such a dangerous practice was ever considered acceptable.
I know.
What are the preferred methods for restraining a patient safely and humanely?
It's all about minimizing the risk of harm while ensuring everyone's safety.
Okay.
Soft restraints applied to the wrists and ankles are generally considered safer,
Yeah.
and the patient should never be placed in a face-down position. Constant monitoring is essential to ensure their airway remains open and that they're not experiencing any distress.
So back to this specific case.
Okay.
What else did the paramedics know about this man's background?
He had a history of schizophrenia,
Okay.
a complex mental disorder that can involve a range of symptoms, including hallucinations, delusions, disorganized thinking, and social withdrawal.
Wow.
It's important to note that not everyone with schizophrenia experiences the same symptoms or severity of symptoms.
So there's no one-size-fits-all approach to caring for these patients.
Exactly.
Each encounter requires a personalized assessment and response.
Exactly. And in this case, it was crucial for the paramedics to understand his specific presentation, his medical history, and the medications he was on. He was taking Risperdal and Zyprexa, both antipsychotic medications, and CNO, an anticonvulsant, sometimes used to manage agitation. These medications can have side effects, so it's important for paramedics to be aware of potential drug interactions or complications.
Now, his ECG readings also revealed some concerning information. Initially, he presented with PEA, similar to the first case we discussed. But after resuscitation efforts, it progressed to normal sinus rhythm, or NSR, with PACs, which are premature atrial contractions.
Can you break that down for us? What does it all mean?
The initial PEA is a serious sign indicating that his heart wasn't pumping blood effectively.
Wow.
It's likely this was brought on by the positional asphyxia he experienced while restrained. The fact that his heart rhythm returned to normal after resuscitation is a positive sign.
Okay, good.
But the presence of those PACs, those extra beads, suggests there might be some underlying cardiac irritability.
So even though he was revived, it doesn't mean he's out of the woods. There could be lingering effects from that period of oxygen deprivation. Precisely. And it underscores the need for thorough post-resuscitation care and ongoing monitoring. These patients require careful observation to ensure they don't experience further complications.
We've covered a lot of ground with these three cases.
We have.
Each one highlighting a different facet of behavioral emergencies. What are some of the key takeaways we should keep in mind?
I think the overarching theme is that behavioral emergencies are complex, multifaceted situations. They demand not only medical expertise, but also a deep understanding of
Continue on Ontario 540 East for 15 kilometers.
commitment to providing ethical, compassionate care.
It's about recognizing that these aren't just medical cases. These are real people in crisis, each with their own unique story and set of challenges.
Absolutely. And paramedics are often the first line of support for these individuals. They need the training, the resources, and understanding to navigate these challenging situations and provide the best possible care.
We've just scratched the surface of these cases. And I'm sure you're eager to hear more about their implications and the lessons they hold.
I am. So let's revisit that first case, the 16-year-old boy found hanging. The textbook asks a pointed question that really gets to the heart of this case. What was significant about the patient's positioning, the padding under the tie around his neck?
The padding stands out as a really unusual detail. It's something you wouldn't expect to see in a typical suicide scenario.
Exactly, and that's why it's so crucial for paramedics to pay attention to those seemingly small details. The presence of padding along with the specific positioning could suggest autoerotic asphyxiation, where the goal isn't suicide, but to heighten sexual pleasure through oxygen deprivation.
It's a difficult concept to grasp, especially in such a tragic context. And I imagine it adds another layer of complexity for the paramedics who are trying to determine what happened.
They have to consider all possibilities while remaining incredibly sensitive to the family's grief. Imagine trying to explain this delicate concept to a father who just found his son. It requires a level of empathy and communication skills that goes beyond just medical knowledge.
Absolutely. It's about acknowledging the human element in all of this, not just focusing on the technical aspects of the case.
Right now, the textbook also challenges us to think about the differential diagnosis in this case. What else could have caused the boy's condition besides hanging or autoerotic asphyxiation?
His history of asthma immediately comes to mind. Could an asthma attack have led to a loss of consciousness and eventually cardiac arrest?
That's a possibility that paramedics have to consider. Asthma attacks can be severe, especially if they're not managed properly. And the symptoms, difficulty breathing, turning blue, can overlap with what we see in a hanging scenario.
So even in a situation that seems straightforward at first glance, there's a lot of detective work involved.
Exactly. Paramedics are trained to look for those subtle clues, to consider all the potential factors, and to never jump to conclusions.
Let's move on to our second case. The 48-year-old man exhibiting manic behavior who was restrained by police. This one raises some interesting questions about how to manage a patient who's already in a highly agitated state.
It's a high-stakes scenario, for sure. The textbook asks a very direct question. Why is the patient presenting with aggression and bizarre behavior?
Well, his diagnosis of bipolar disorder certainly seems relevant here. Could you explain how bipolar disorder can manifest in such extreme behavior?
Bipolar disorder is characterized by those extreme shifts in mood, from mania to depression.
Right.
During a manic episode, individuals can experience racing thoughts,
Okay.
heightened energy, impulsivity, and even psychosis, which can explain the bizarre behavior and aggression we see in this case.
So it's not simply a matter of someone being difficult or uncooperative.
No.
There's a biological basis for their behavior, a chemical imbalance in the brain.
Precisely. And it's essential for paramedics to understand that context when they're approaching a patient like this. They need to recognize that the behavior isn't intentional or malicious. It's a symptom of a complex neurological condition.
Now, the textbook also asks about the best approaches for dealing with a manic patient versus a depressed patient. It seems like those would require very different strategies.
Absolutely, when dealing with a manic patient like the man. In this case, the priority is de-escalation.
Oh, okay.
Speaking calmly, validating their feelings, and avoiding confrontation can help reduce agitation.
But wouldn't that be challenging when the patient is already restrained and potentially struggling against those restraints?
It can be, and it requires a delicate balance of ensuring safety while also respecting the patient's dignity.
Right.
Sometimes simply acknowledging their distress and explaining what's happening can make a difference.
What about medication? Would that be a consideration in this situation?
It could be if the patient is a danger to themselves or others, or if their mania is so severe that it's preventing them from receiving necessary care. Medication might be administered, but it's not a decision to be taken lightly.
Right, because medication can have side effects, and you have to consider the patient's autonomy as well.
Exactly. It's a complex ethical dilemma that paramedics often face in the field.
Right.
They have to weigh the potential benefits of medication against the potential risks and the patient's right to refuse treatment.
Now, you mentioned earlier that bipolar disorder is cyclical,
Yes,
meaning that manic episodes can be followed by depressive episodes.
right.
How does that impact the way paramedics approach a patient with bipolar disorder?
It means they need to be aware that the patient's presentation can change dramatically from one encounter to the next.
Right.
Someone who is manic and agitated today could be withdrawn and lethargic tomorrow.
So it's not just about addressing the immediate crisis, but also recognizing that this is a long-term condition that requires ongoing care and support.
Precisely. And it underscores the need for communication and collaboration between paramedics, mental health professionals, and other support systems in the community.
Let's move on to our final case. The 34-year-old man with schizophrenia who was found unconscious after being subdued by police.
Okay.
This one raises some serious concerns about the use of restraints and the potential for harm.
This case is a stark reminder of the responsibility that comes with restraining a person, especially someone experiencing a mental health crisis.
Yeah.
The textbook asks a very pointed question. Should hog tying be utilized in the field for patient restraint?
Okay.
And the answer is a resounding no.
That seems pretty definitive what makes hog tying so dangerous.
Hog tying involves binding a person's hands and feet together behind their back,
God.
often in a face-down position.
Right.
It severely restricts breathing and can quickly lead to positional asphyxia, which is exactly what happened in this case.
It's disturbing to think that such a dangerous practice was ever used.
Yeah.
What are the preferred methods for restraining a patient safely?
It's all about minimizing the risk of harm, while ensuring everyone's safety soft restraints applied to the wrists and ankles are generally considered safer, and the patient should never be placed in a face-down position.
That makes sense. It's about finding that balance between protecting the patient and protecting those around them.
Exactly, and constant monitoring is crucial. Paramedics need to constantly assess the patient's breathing circulation and overall well-being to ensure the restraints aren't causing any harm.
So in this case, the patient had a history of schizophrenia. Could you explain a bit more about that condition and how it might have contributed to his behavior?
Schizophrenia is a complex mental disorder characterized by a range of symptoms, including hallucinations, delusions, disorganized thinking, and social withdrawal. It's important to remember that not everyone with schizophrenia experiences the same symptoms or severity of symptoms.
So there's no one-size-fits-all approach to caring for a patient with schizophrenia.
Exactly. Each encounter requires a personalized assessment based on the individual's specific presentation and needs. In this case, the paramedics needed to understand the man's history, the medications he was on, and the specific triggers that might have led to his crisis.
His medications included Risperdal and Zyprexa, which are antipsychotics, and CNO, which is sometimes used to manage agitation. What should paramedics know about these medications when they're treating a patient with schizophrenia?
It's essential to understand that these medications can have side effects, and some can interact with other drugs. Paramedics need to be aware of those potential interactions and be prepared to manage any complications that might arise.
Now, his ECG readings also painted a rather complex picture. He initially presented with PEA, which we discussed earlier, then progressed to a normal sinus rhythm with PACS after resuscitation. What can we learn from that?
The initial PEA is a serious sign indicating that his heart wasn't pumping effectively. It's likely this was a result of the positional asphyxia he experienced. While restrained, the fact that his heart rhythm returned to normal after resuscitation is a positive sign. But the presence of those PACs, those extra beats, suggests there might be some underlying cardiac irritability.
So even though his heart rhythm stabilized, it doesn't mean he's out of danger. There could be lingering effects from that period of oxygen deprivation.
Precisely. It highlights the importance of thorough post-resuscitation care and ongoing monitoring. These patients need close observation to ensure they don't experience further complications.
We've explored these three cases in depth, uncovering the layers of complexity that paramedics face when responding to behavioral emergencies. As we move into the final part of our deep dive, what are some key themes that have emerged from these discussions?
I think the overarching message is that behavioral emergencies are rarely straightforward. They demand a unique blend of medical knowledge, compassion, and critical thinking skills.
It's not just about treating the symptoms, it's about understanding the person behind the crisis.
Absolutely. And as we delve deeper into the questions posed by the textbook and explore the broader societal context, we'll see how these themes play out on a larger scale.
We've laid the groundwork with these cases, and now it's time to expand our perspective and explore the bigger picture. Stay tuned for the final part of our deep dive. So we've explored the medical complexities of these cases, the diagnostic challenges, and the ethical considerations. But now I want to shift our focus to the human element.
In 500 meters, turn right onto Meredith Street East, Ontario 540 East.
Real people experiencing real crises.
Yeah, it's so easy to get caught up in the technical details and forget that we're dealing with human beings who are often scared, confused, and in desperate need of understanding.
The textbook we've been using really emphasizes that point by asking questions that go beyond the purely medical, for example.
Turn right onto Meredith Street East, Ontario 540 East.
What is this act of self-gratification commonly labeled by law enforcement agencies?
And the answer can be quite jarring. Autoerotic
Continue for 48 kilometers.
suicide or even homicide without clear evidence to the contrary. Law enforcement might jump to conclusions that further traumatize the family and misrepresent what truly occurred.
It's a stark reminder that assumptions can be dangerous, especially in these sensitive situations. It highlights the need for thorough investigation, open communication, and a willingness to consider all possibilities.
Absolutely, and the textbook also delves into the emotional impact on those involved, particularly the father who found his son, it asks. What is difficult for the father and others affected by this incident?
I can only imagine the guilt, the confusion, the grief compounded by the social stigma surrounding such a death.
It's a heavy burden to carry, and paramedics, who are often the first to arrive on the scene, play a crucial role in providing support that goes beyond medical.
It's about recognizing the emotional turmoil the family is going through, acknowledging their loss, and offering a sense of humanity amidst the chaos.
Exactly. It's about treating them with dignity and respect, even in the midst of a difficult investigation.
Now, the second case, involving the man with bipolar disorder, also prompts us to think about the long-term management of this condition, the textbook asks. What are the classifications of the patient's medications? What are the best approaches for dealing with a manic patient versus a depressed patient?
Yeah, it's emphasizing that this isn't just a one-time encounter. Paramedics might encounter this individual again, perhaps during a depressive episode, which presents a whole different set of challenges.
So it's not just about addressing the immediate crisis, but also recognizing that bipolar disorder
Head east on Ontario 6.
requires ongoing care and understanding.
Precisely, and the approach to a manic patient who might be agitated
Head east on Ontario 6.
differs significantly from the approach to a depressed patient who might be withdrawn and lethargic.
It underscores the need for paramedics to be adaptable, to tailor their responses to the specific needs of each patient at each encounter.
And to recognize that mental health is a spectrum, not a fixed point. People can move along that spectrum and their needs will change over time.
Finally, the case
Continue on Ontario 6 for 51 kilometers.
raises some broader societal questions. The textbook asks, what is agitated delirium? what is schizophrenia? Should hog tying be utilized?
It's prompting us to examine how we as a society respond to individuals experiencing mental health crises. Agitated delirium, characterized by extreme agitation and often aggression, can be incredibly frightening for both the individual and those around them. But the use of excessive force or dangerous restraints like hog tying is never the answer.
It speaks to the need for better training for law enforcement and first responders training that emphasizes de-escalation techniques, mental health awareness, and the appropriate use of restraints.
We need to shift from a culture of control to a culture of care when it comes to interacting with individuals with mental health challenges. This includes recognizing the signs of a crisis, understanding how to communicate effectively, and knowing when to call for medical assistance.
We've covered a lot of ground in this deep dive. We have explored the medical intricacies of behavioral emergencies, delved into the ethical dilemmas faced by paramedics, and examined the broader societal context of mental health care. What's the lasting message you hope our listeners take away from this?
I think it boils down to this. We need to approach behavioral emergencies with both our heads and our hearts. We need to be clinically competent, of course, but we also need to be compassionate and understanding and truly present for those in crisis. We need to see beyond the diagnosis and recognize the individual human being who deserves our care and respect.
That's a powerful call to action. We can all play a role in creating a more supportive and empathetic world for those struggling with mental health challenges. Thanks for joining us for this insightful deep dive, and until next time, keep those minds curious and those hearts open. All right, let's jump into it. Today, we're tackling emergency cardiology.
Oh yeah, those high stakes calls.
You got it, using what we have here, 4 case studies from a medical textbook.
That's right, those tricky scenarios paramedics face.
Yeah, and we'll unpack how they make those tough decisions, out in the field with limited info.
Yeah, limited info, ticking clock, life or death.
Absolutely. So let's dive right into the first one.
Okay.
This one puts us right into a nursing home.
Right.
Freezing January morning. You arrive and find an elderly woman, she's in her 70s, struggling to breathe.
Oh, that's rough.
She's conscious, but it's not looking good. Shallow breaths, you can hear crackles in her lungs, pale, sweating profusely.
Okay, so right away you're thinking respiratory distress.
Right.
What's causing it? Cardiac event? Maybe.
Could be.
But always got to keep an open mind, right?
Yeah.
Pneumonia, something else.
So many possibilities.
Yeah.
And adding to that, she's got a history of congestive heart failure.
Oh, okay, so that's a big piece of the puzzle.
Big piece. And she's on a bunch of meds.
What's that?
Lasix, a diuretic, and digoxin for her heart rhythm.
Okay, so her meds give us some hints right there. Lasix, that means she's probably dealing with fluid buildup, maybe her heart's not pumping as well as it should. And then the digoxin, that often means the heart needs a little help to keep a steady beat.
So we've got respiratory distress, history of CHF, meds hinting at underlying heart issues. And then you check her vitals, blood pressure sky high, 200 over 160.
Whoa.
Pulse is racing at 150 and irregular, and her oxygen saturation is dipping down to 88%.
Yeah, this is all pointing towards a serious cardiac event.
It really is. And think about what's happening inside her body.
Yeah.
Her heart's struggling to keep up, like a pump that's failing.
Exactly, that's why you see that high blood pressure, that rapid pulse.
And the fluid building up in her lungs, making it harder and harder to breathe, hence the low O2 sat. So what's the first thing a paramedic does? Every second counts in this situation, right?
Absolutely. Immediate priority is oxygen. Get that into her system.
Okay.
And then address that potential heart failure and the fluid in her lungs.
Okay.
The source material mentions starting an IV and giving nitroglycerin.
Oh, nitroglycerin.
Yep, that helps dilate those blood vessels.
Like widening the pipes to ease the pressure.
Exactly. Improve blood flow to the heart.
But then the textbook mentions something interesting.
What's that?
Transporting her in a semi-Fowler's position.
Sitting her up at a 45-degree angle.
Why is that so important? Wouldn't you want to keep her lying down and still?
You'd think so, right?
Huh?
But think about it. When she's lying flat, gravity is working against her.
Oh, okay.
It's harder for her diaphragm to expand, for her lungs to fill up with air. But sitting her up helps her breathe a little easier, reduces the workload on that already strained heart.
So a simple change in position can make a big difference.
Huge difference. It's all about those little details. In this case, really shows how paramedics got to think critically and consider everything when they're making those decisions out there.
Okay, let's move on to case 12.2.
All right, what do we got?
Dinner time, you're called to a busy restaurant.
Oh, yeah?
You find a woman in her late 50s. She's just fainted.
Oh, man.
She's conscious, but she's confused, pale, sweating, struggling to catch her breath.
All right, so what caused her to faint? That's the first thing you're thinking. But there's this key detail. The source mentions her symptoms started right after she ate.
So could there be a connection between her dinner and the fainting?
Definitely something to think about.
Definitely.
Now, she does have a history of a heart attack, hypertension, and diabetes.
Oh, wow.
And she's on a bunch of meds, too.
So are those medications part of the puzzle too?
They absolutely could be.
Right.
She's got an NTG patch for angina, Cardizem for blood pressure, Paxil for anxiety, and others.
Wow, that's a lot.
We have to think about side effects, interactions.
Oh, yeah.
Could any of these be contributing?
Okay, so complex medical history, a list of meds to consider. What do her vitals tell us?
Blood pressure's low, 80/60, and her pulse is regular at 84, but it's weak.
Okay.
Now, given her history, these findings could point to a few things.
Like what?
Could be related to her heart, a complication from her diabetes, even a side effect from one of her meds.
It's like a web, trying to figure out what's connected.
Exactly.
So what are the first steps to treat her?
Source material mentions oxygen and stabilizing that blood pressure.
Okay.
But there's a big caveat here. They specifically say no aspirin.
Why not? Isn't aspirin usually given when you suspect a heart attack?
Usually, yes, but her low blood pressure makes it risky.
Oh, okay.
Aspirin thins the blood, and giving it to someone with low blood pressure could make it even lower, lead to more problems.
So even though aspirin is usually a good thing in these situations, it's not a one-size-fits-all?
Definitely not. Good reminder that paramedics have to consider everything. Medical history, symptoms, vital signs, the whole picture.
Absolutely. All right, ready for case 12.3.
Hit me with it.
This time you're called to a home where a 72-year-old man is having chest pain
All right.
right after breakfast.
Interesting. That timing, right after a meal.
Right.
Could be something simple like indigestion,
Could be.
or something more serious like angina.
Right.
What else do we know?
He's conscious, alert, sweating, but his radial pulse is strong.
Okay, good sign.
And he has a history of hypertension, diabetes, arthritis, and a previous hernia repair.
So we're dealing with a few pre-existing conditions here.
We are,
Could complicate things.
definitely. And his vitals show elevated blood pressure 132/90,
Okay.
rapid pulse at 170, but regular.
Those vitals with the chest pain, that's a red flag.
Definitely.
Makes you think about heart attack.
Right, and the EKG adds another layer.
What's it showing?
Initial reading shows a rapid heart rate.
Okay,
But as things progress, it starts to show some worrying changes.
not good.
And then things get really intense. The source material says he starts vomiting and then loses consciousness.
Whoa, rapid decline. What's going on in his body?
Sounds like his condition's deteriorating fast.
Yeah.
Vomiting could be from the pain.
Okay,
Loss of consciousness probably means blood flow to the brain is compromised.
right. Likely due to a major cardiac event.
So what's the plan of action here?
Priorities are oxygen, aspirin, nitroglycerin, and getting ready for a potential cardiac arrest.
So it's a race against time.
Absolutely, gotta move fast.
This case really shows how a stable situation can turn critical in an instant.
It does.
Importance of early intervention, recognizing those subtle signs that something is seriously wrong.
Yeah, you gotta be on your toes.
Okay, on to our final case for this part of our deep dive. Case 12.4.
Right, bring it on.
Warm night. You're called to a house.
Okay.
55-year-old man complaining of sharp, really bad chest pain that radiates to his back.
Oh, that radiating pain, that's a big clue.
It is.
Often means we're dealing with something more than just muscle or bone pain.
And the pain started suddenly as he was getting ready to go to the bathroom.
That sudden onset, the specific timing, those are crucial pieces of information.
They are.
Suggest a sudden event, not a gradual buildup.
Right, like something just happened.
Exactly.
We also find out he has a history of hypertension and a heart attack 3 years ago.
Okay, so he's already vulnerable to heart problems.
He is, and he's currently taking Sectrol, that's a beta blocker for his blood pressure,
Oh,
and some other meds for pain and anxiety.
got it.
Vitals are troubling, blood pressure is low, 70/60, pulse is weak and slow at 38.
Oh,
And the source material mentions poor circulation, mottled appearance in his lower extremities.
those are really concerning findings.
They are.
Low blood pressure, the mottled skin, suggests his tissues aren't getting enough oxygen.
Right, like his body's struggling to circulate blood properly.
Exactly.
And his EKG, what does that show?
Shows a dangerous heart rhythm called ventricular tachycardia.
What does that mean?
Means his heart's beating too fast for the ventricles to fill up with blood properly, so his circulation's compromised.
Oh, wow.
Yeah, not good.
So, putting it all together, what's the likely diagnosis here?
Based on everything, the pain, the low blood pressure, circulation problems, the EKG, the source material points to a potential aortic dissection.
Aortic dissection, so a tear in the aorta, the main artery.
That's it. And if that tear gets bigger, it could be catastrophic.
Oh, wow. So, what are the treatment priorities here?
Oxygen right away, get an IV line in, and transport, get to the hospital ASAP.
But there's a caution about giving a fluid bolus, right? Why is that?
Yeah, a fluid bolus is usually used to raise blood pressure, but with a suspected aortic dissection, it's risky.
How so? Wouldn't you want to raise his blood pressure if it's low?
You would think so, but think about that tear in the aorta.
Okay.
If we suddenly increase his blood volume and pressure, we could actually make the tear worse, even cause a rupture.
So it's about weighing the benefits against the risks.
Exactly. And in this case, less is more. Stabilize him, get him to the hospital fast, let the surgeons handle it.
It's all about getting him to the right place for the right care.
Exactly. Welcome back to our deep dive,
Yeah.
to emergency cardiology.
We've covered some pretty intense stuff already, but we're really trying to learn from these cases.
Absolutely.
So let's go back to that first one, the elderly woman in respiratory distress at the nursing home.
Okay.
One thing that really stuck with me was her history of congestive heart failure.
Yeah, CHF, it's common, especially in older adults,
Right,
but it can be tough to manage.
for sure.
In fact, the textbook asks, what are the telltale signs and symptoms of CHF?
It's a good question because those signs can be pretty subtle, especially at first.
Exactly, it can sneak up on you.
Right.
The textbook highlights shortness of breath, especially when lying down.
Okay.
Persistent cough or wheezing, swelling in the legs and ankles, fatigue, rapid or irregular heartbeat, difficulty exercising.
Wow, so it can really affect the whole body.
It does, it's like a domino effect.
Right, the heart's not pumping, right?
Yeah.
Fluid starts to back up, and then all these other systems start to struggle.
Exactly, the body's working overtime.
The textbook also asks this interesting question. Why do episodes of CHF often happen in the early morning hours?
Oh, that's a good one. Have you ever noticed that?
Now that you mention it, yeah, I think I have.
It's those natural body rhythms.
Okay.
During sleep, heart rate and blood pressure naturally go down.
Right.
But with CHF, that weakened heart, it might struggle to adapt. Leads to fluid buildup in the lungs overnight.
So they wake up feeling worse.
Exactly, shortness of breath, all those
As
symptoms,
if their body's working against them while they sleep.
pretty much.
The textbook also dives into her medication.
Okay, yeah, she was on a few.
Right, like Lasix, the diuretic, and digoxin for her heart rhythm.
Right.
So how do those meds fit into the overall picture?
Well, Lasix helps get rid of that excess fluid, ease the strain on the heart,
Okay.
but diuretics can also mess with electrolytes,
Oh, right.
which can then affect heart rhythm.
So a med meant to help could actually backfire.
It can, that's why monitoring is so important.
Right, and then there's digoxin.
Yeah, digoxin,
It can help regulate the heart rhythm,
you can,
but it can also have side effects.
yeah, especially if the dosage isn't right.
It's like a constant balancing act with these medications.
It really is, finding that sweet spot.
The textbook also asks about positioning.
Mm-hmm.
Why should this patient not be placed flat on her back during transport?
Another good question. You'd think lying down would be best.
Right, keep them still.
But remember, she's having trouble breathing.
Okay.
Lying flat can actually make that worse.
Why is that?
Think about it. Her lungs are already full of fluid.
Right.
When she's flat, gravity pulls everything down, puts more pressure on her diaphragm, makes it harder to breathe.
Makes sense.
Sitting her up, that semi-Fowler's position, helps reduce that pressure.
So it's all about those little details, like positioning.
Absolutely can make a big difference.
Okay, let's move on to case 12.2, the woman who fainted at the diner.
Oh yeah, that one.
I remember one interesting detail from the source material.
What's that?
She was pretty argumentative when the paramedics arrived.
Oh, that can be tough.
It can.
But gotta remember, their behavior,
Yeah.
it's often influenced by things beyond their control.
Like what?
Think about it. She just fainted in public, probably embarrassed, confused, maybe even scared.
Yeah, I can see that.
All those emotions, they can lead to agitation.
Makes sense. Good reminder to approach every patient with empathy.
For sure.
The textbook also asks about her medications.
She was on a few.
An NTG patch for angina, Cardizem for blood pressure, Paxil for anxiety.
All right.
So could those meds be contributing to her fainting?
Well, both NTG and cardizem can lower blood pressure,
Okay.
which is what they're supposed to do. But sometimes it can cause a sudden drop, leading to fainting.
So the intended effect could actually be a problem in this case.
Exactly.
And what about the Paxil anxiety meds? Can they affect blood pressure too?
Paxil itself doesn't directly lower blood pressure,
Okay.
but anxiety itself can sometimes cause a temporary drop, leading to lightheadedness or fainting.
It's like everything's connected.
It really is mind and body.
The textbook also asks a very practical question.
Oh yeah,
What's the bill way to move this patient from her chair to a stretcher?
good question. Yeah, think about that.
What would you recommend?
Well, she's weak, having trouble breathing, so we want to minimize any extra movement or strain.
Right.
The textbook recommends a direct lift, at least 3 rescuers.
Teamwork makes the dream work.
Exactly. You've got to communicate clearly, make sure the patient feels safe.
The textbook also throws out a few possible diagnoses:
Okay, like what?
cardiac insufficiency, acute myocardial infarction.
So heart failure or a heart attack?
Yeah, both serious possibilities.
They are.
Heart failure could explain the low blood pressure, the breathing problems,
Right.
and a heart attack, well, that could be triggered by the stress of the situation, especially with her history.
Makes sense.
So it's like solving a puzzle, trying to put all those clues together.
Exactly. What's the underlying cause?
And sometimes you need more info, like tests at the hospital, to get a definitive answer.
Absolutely. Sometimes the picture isn't clear right away.
Okay, let's move on to case 12.3. The 72-year-old man with chest pain after breakfast.
Yeah, that one.
One thing that stood out to me in this case was the use of aspirin.
Oh, yeah.
The textbook asks, why is aspirin included in the treatment of this patient?
Aspirin, it's a workhorse in emergency medicine,
It is.
especially when we suspect a heart attack.
Right.
It stops those blood platelets from clumping together, forming clots.
So it's keeping those arteries open, blood flowing to the heart muscle.
Exactly. Time is muscle when it comes to a heart attack.
Right, the faster you restore blood flow, the less damage.
Exactly.
The textbook also asks about his medications.
Right. He was on quite a few.
Plendil for blood pressure, glucotrol for diabetes, Dilantin for seizures, naproxen for pain and inflammation.
Wow. That's a lot to keep track of.
It is, and some of those meds, like the naproxen, can actually increase the risk of heart problems.
Oh, interesting. So his meds could be part of the problem, while AD the solution.
That's a good way to put it. It's a delicate balance.
It is managing multiple conditions,
Yeah.
meds with overlapping effects, sometimes even conflicting.
The textbook also highlights this question: what is the benefit of morphine in treating this patient?
Morphine, that's a strong pain reliever.
Right, essential in a heart attack.
Absolutely. But it does more than just manage pain. It's also a vasodilator.
So it widens those blood vessels, improves blood flow.
Exactly. Gives the heart a little break, reduces its workload.
Smart.
I remember the source material also talks about assessing his skin.
They do. They ask, what should a paramedic look for in reference to the skin?
Right, skin can tell you a lot.
Why is skin assessment so important in these situations?
It gives you a quick snapshot of circulation, overall health.
Okay.
We look for changes in color, temperature, moisture, and terroir.
Okay, break that down for me. What does abnormal skin color tell you?
Well, pale or mottled skin, that could mean poor perfusion.
Meaning,
The tissues aren't getting enough oxygen.
and temperature.
Cool or clammy skin, that can also mean poor perfusion.
Okay,
Warm, flushed skin could mean fever or infection.
got it. What about moisture?
Excessive sweating, that can be a sign of shock or a cardiac event.
Okay, and turgor. What's that?
Turgor is the skin's elasticity.
Okay.
You pinch the skin, doesn't spring back quickly, could be dehydration.
It's amazing how much you can learn just by looking at someone's skin.
It is, it's a powerful tool.
The source material also throws in some practical questions about equipment.
Like what?
What is the proper placement for defibrillator pads?
Defibrillation placement is key.
It is.
One pad goes on the right side of the upper chest, below the clavicle. The other pad goes on the left side, along the mid-axillary line, basically down from the armpit.
So it's not just about slapping those pads on anywhere.
Nope, gotta be precise.
It's about making sure that electrical current goes right through the heart.
Exactly, restore that normal rhythm.
The textbook also mentions confirming endotracheal tube placement.
Oh yeah, gotta make sure that tube's in the right spot.
It is
What techniques do they describe?
auscultation.
So listening for breath sounds.
Yeah, you want to hear those sounds on both sides of the chest.
Right, equal breath sounds means the tubes in the trachea, the windpipe,
And what if you hear those sounds in the stomach?
Uh-oh, that's bad news.
Bad news.
Means the tube went down the esophagus, not the trachea. Patient's not getting air.
So what are some other ways to confirm placement?
They mention watching for chest rise and fall.
Okay, make sure those lungs are inflating.
Exactly. And they also talk about capnography.
What's that?
It measures carbon dioxide levels in the breath.
Okay.
A high reading means the tube's in the right place.
So multiple ways to double check, make sure the patient's getting air.
Exactly. Gotta be thorough.
All right, let's wrap up this part by revisiting case 12.4, the man with the sudden severe chest pain.
Yeah, that's suspected aortic dissection.
Right, the textbook asks, what cardiac rhythm is the patient presenting with?
He was in ventricular tachycardia, or VTach.
VTach.
Yeah, like threatening rhythm.
Dangerous stuff.
It is. His heart was beating too fast for the ventricles to fill up with blood properly.
So his circulation was compromised.
Exactly.
The textbook also asks why he had poor circulation and that mottled appearance in his legs.
Right, that's connected to the aortic dissection.
How so?
Well, the aorta is the main highway for blood from the heart.
Right.
When there's a tear, it can disrupt blood flow, especially to areas farther away, like the legs.
So the tear is like a detour in the circulatory system.
Exactly, and that's why you see those signs, the weak pulses, the mottled skin, the paleness.
That is a sign those tissues aren't getting enough oxygen.
Right, they're being starved of blood.
The textbook also wants us to look back at his meds.
Cool.
He was taking Sectrel for blood pressure, Tylenol, #3 for pain, and a couple of others.
Right, quite a few.
Do any of those raise any red flags in this situation?
The Sectrel, the beta blocker, that's an interesting one.
How so?
Beta blockers, they're usually helpful for blood pressure, heart conditions.
Right.
But with an aortic dissection, they can sometimes mask the symptoms.
So the medication could be hiding the problem.
It's possible, which is why getting a complete medical history is so important.
Makes sense. You need all the information to make the right call.
Absolutely.
The textbook also digs into the decision to give a fluid bolus.
Oh, yeah, that's a tricky one.
They ask, why should you be cautious regarding the administration of a fluid bolus in this patient?
Powerful.
A fluid
Does not
bolus,
mean-
it's usually used to raise blood pressure.
Does
Right,
not mean
which seems like it would be a good thing in this case.
You'd think so, but with a suspected aortic dissection, it can backfire.
Okay, I'm
It's-
seeing a
it's
pattern
thing,
here. Why is
It's
that?
almost
Remember,
like
there's a tear in the aorta.
Right.
If you suddenly increase blood volume and pressure, you could make the tear worse, maybe even cause a rupture.
So it's a judgment call, weighing the risks and benefits.
Exactly. In this
I
case,
don't know.
the priority is getting him to surgery ASAP.
Where they can repair that tear.
Exactly.
Welcome back to the final part of our deep dive. It's been a wild ride through emergency cardiology.
It has been so many twists and turns, but always something new to learn, especially when it comes to the heart.
Absolutely, so vital. And these cases really show how much paramedics need to know to make the right call in those intense moments.
Yeah, they're like walking encyclopedias of emergency medicine.
They really are. So let's revisit that last case, the man with the suspected aortic dissection.
Okay, the one where every second counted.
Right. The source material asks a great question about aortic aneurysms.
Interesting.
What are the typical signs and symptoms?
Good question, because while aneurysms are different from dissections, they can be just as dangerous.
Right. Can you remind us what an aneurysm is again?
Think of it as a weak spot in the aorta, that main artery.
Okay.
That weak spot, it bulges out, kind of like a balloon. And if it pops, massive internal bleeding.
Oh, wow. That's scary.
It is, so paramedics need to be on the lookout for any signs.
So what are some red flags? What should they be looking
Textbook mentions a few things.
for? Okay.
One is a pulsating sensation in the abdomen.
So like feeling a heartbeat in their stomach?
Exactly, that's a pretty specific sign.
Wow. What else?
Sudden severe pain in the chest, back, or abdomen, often described as sharp, tearing, ripping.
And the pain our patient was having.
Yeah, the pain patterns can be similar, which is why a good assessment is so important.
And tell the difference.
Exactly, you gotta rule things out.
Any other symptoms to be aware of?
Dizziness, nausea, vomiting, shortness of breath, sweating,
Sure.
clammy skin, all of those can be associated with an aneurysm.
So a lot of different things to consider.
Yeah, it can be tricky, and the textbook makes a point of differentiating between a dissection and an aneurysm.
Right. We've been talking about both, but they're not the same.
Definitely not. So think of a dissection as a tear in the lining of the aorta.
Okay.
Blood can then seep between the layers, and that weakens the aorta, makes it bulge, which could lead to a rupture.
So the dissection is the tear, the aneurysm is the bulge.
That's it. And an aneurysm It can develop gradually, over time because of things like high blood pressure or hardening of the arteries.
Okay.
But a dissection, that's usually a sudden event triggered by a spike in blood pressure.
So it happened out of the blue?
It can, yeah. That's why knowing the signs is so important.
Absolutely. The textbook also asks about the causes of aortic aneurysm.
Right. What puts people at risk?
So what are some of the risk factors?
Atherosclerosis, that buildup of plaque in the arteries. That's a big one.
Makes sense?
High blood pressure is another. Puts stress on those artery walls.
Right. Anything else? Like lifestyle factors?
Oh yeah, smoking's a big one.
Of course.
Damages the blood vessels, increases the risk of atherosclerosis and high blood pressure.
Double whammy.
Exactly. And genetics can play a role too.
Okay.
Some people are just more prone to aneurysms, especially those with certain connective tissue disorders.
Like Marfan syndrome.
Exactly, that's one of them.
The source material also mentions IV access.
Yeah, that's always important in these situations.
They ask, why should a large 4-5E catheter be used?
Good question. The size of the catheter, it matters because of potential fluid loss.
Okay.
If that aneurysm bursts, the patient can bleed out fast.
That's terrifying.
It is. So a larger catheter, it allows you to get fluids and blood into the system much quicker.
So it's a matter of time.
Absolutely. Every second counts.
Gotta be prepared for anything.
Always.
This case really highlights how important it is to recognize the signs and to understand why we do what we do.
It's not just about memorizing the protocol.
Right. It's about understanding the reasoning behind those actions.
Exactly. So you can adapt and make good decisions in tough situations.
Well, I think we've successfully dissected these 4 cases.
We did it.
Uncovered some amazing insights along the way.
It's been quite a journey.
What really stood out to you?
I think, for me, it's how every single detail matters.
It all adds up.
It does. Patient history, meds, vitals, even their position. It all
You deal with
helps you
that. I don't gotta
understand
deal with
what's going on.
nobody
And
like that, bro.
it's
That's your
incredible
problem.
how
I ain't trying to
paramedics
do
can
anything.
process
I don't need
all
a
that
lot.
information so
That's your
quickly
problem.
under pressure.
It's amazing. They're true
Don't
heroes.
throw that on
Absolutely.
me.
And to our listeners, we hope this
Talk
deep
about
dive
me.
gave you a glimpse into the world of emergency cardiology.
Eating this for
And
my
maybe an
family.
appreciation for those amazing
You don't even know
paramedics.
me, bro.
Absolutely. Thanks for joining us on this incredible journey. Until next time, stay curious and keep learning.
Welcome back, everyone, to the Deep Dive. Today, we're taking a look at a topic that's, well, a bit intense. Emergency response to chemical incidents.
Definitely a high stakes area.
Absolutely. And to guide us through this, we've got, as always, some pretty interesting source material.
Classics.
Always love seeing what you dig up.
Well, this time, we've got a chapter from a paramedic textbook. Pretty detailed stuff.
So we're getting into the nitty gritty.
We are. And to add to that, a real-life case study.
Ooh, those are always fascinating. You really get to see the theory put into practice.
Exactly. So let's dive in, shall we?
Let's do it.
The textbook kind of sets the stage with this quote. Post 9/11, the world has become a different environment. Emergency preparedness is the most important element available to paramedics in such situations. Pretty sobering thought, right?
It really is. And while 9/11 obviously brought airport security to the forefront, it also just really heightened awareness about all kinds of potential threats, including chemical attacks.
And that preparedness aspect, it's got to be top of mind for any first responder.
Absolutely crucial.
All right, so let's jump into this case study. It starts off with a student demonstration. Things get a little out of hand. Possible explosion.
Oh, that's never good.
No, it's not. And we end up with a young man, some burns, and he's having real trouble breathing.
So already a pretty serious situation.
Yeah, and it gets even more complicated because they find canisters of chlorine nearby, like chlorine gas.
Chlorine, yeah. Now that's a whole different ballgame. I mean, most people when they hear chlorine, they think, swimming pools, keeping things clean.
Right, exactly.
But chlorine in its pure gaseous form, that's highly reactive. It can be really
I got a
dangerous.
double
So
cut,
in this
bro.
case study, they talk about the burns on his
Like, dude,
hands,
you got a
first
double
degree,
cut.
about 5% of
In
his
your case,
BSA.
you just got stopped
Now, how do
again.
paramedics even
You got a
figure
double
that
cut.
out on the fly? What's BSA anyway?
So BSA stands for body surface area.
Double cut.
It's essentially a quick way to assess how much of the body is affected by burns, to gauge the severity. And that BSA number, it's crucial for figuring out treatment and spotting potential complications. Out in the field, paramedics use what they call the rule of nines.
The rule of nines.
Yeah, it's a system where they assign percentages to different body parts, and it all adds up to, 99. Like the head and each arm are 9%, front and back of the torso, each 18%, each leg 18%. There's a modified version for kids because, the proportions are different.
Okay, makes sense. So in our case study, 5% BSA with the burns on his hands. Even though it might seem like a small area, that could really mess with his ability to use them, right?
Absolutely. Hands are, well, pretty essential.
Understatement of the year.
Okay.
Okay, so we've got burns, we've got chlorine gas. What exactly happens when someone breathes that stuff in?
So chlorine gas, it's a powerful irritant. I mean, think about your respiratory system, all those delicate tissues. Chlorine just attacks them, basically. Yeah, so it can cause this burning sensation, coughing, makes it hard to breathe. And how bad it gets really depends on, well, how much chlorine there was and how long they were breathing it in.
The case study mentions this treatment, nebulized sodium bicarbonate.
Yeah.
They considered it, but it sounds kind of controversial. What's the deal with that?
Yeah, so nebulized sodium bicarbonate is basically this fine mist that you inhale, and the idea is to, neutralize the acid effects of the chlorine in the lungs. But it's not a standard treatment. There's some back and forth about how effective it actually is. And there are concerns about potential side effects, things like fluid buildup in the lungs, especially if it's not done just right. So, it's a judgment call.
So our paramedics here, they're really in a tough spot, weighing the potential good against the potential bad. What else would they be thinking about when making a decision like that?
Well, you got to remember, they're out there in the field. It's a dynamic environment. Things are changing. They have limited information. They have to consider the patient's condition, what resources they have available, whether they can get them to a hospital quickly. It's all about making the best call with the information they have at that moment.
It really highlights the complexity of this whole world, right?
Yes, every situation is unique.
And speaking of complexity, the textbook mentions that there can be long-term effects from chlorine exposure too. What are some of those?
Right. So while many people do recover completely, some end up dealing with lingering issues. Like one condition that can develop is called reactive airways dysfunction syndrome.
Okay, RADS.
Yeah, RAD. And basically, it's a lung disorder that can pop up after breathing in irritants like chlorine gas. It causes symptoms that are, well, kind of similar to asthma: wheezing, coughing, shortness of breath, that feeling of tightness in the chest. Imagine having a persistent cough or, feeling like you can't quite catch your breath, even weeks or months after the exposure. That's the reality for some folks who develop RADS.
Man, that's rough.
Yeah.
Really makes you think about the bigger picture here.
It definitely does.
We've touched on some of the immediate dangers of chlorine, but there's this whole other layer of complexity with the long-term effects.
Yeah, it's not just about the here and now.
Exactly. And I'm really curious to explore that further.
Well, let's do it.
So we were just talking about those long-term effects of chlorine exposure, and it really makes you think about the bigger picture here.
It does, doesn't it?
And that textbook really emphasizes how 911 was this major turning point for emergency responders. Like it forced them to think about things in a whole new way.
Oh, absolutely. 9/11 really brought about this shift in mindset. I mean, first responders now have to consider a much wider range of potential threats, including these chemical attacks. And that's had this ripple effect on everything, from their training to the protocols they follow, even the equipment they use.
So what are some of the biggest changes that have come about?
Well, for one, there's a much heavier emphasis on hazardous materials training now.
Hazmat training.
Yeah. Paramedics really need to be able to identify like a whole slew of different chemicals, understand their properties and know how to handle them safely. It's like adding this whole new layer of complexity to an already demanding job.
Sounds intense.
It is. And then there's the whole issue of on-scene safety.
Right. Because you don't want to become a casualty yourself.
Exactly. They've got to be hyper aware of their surroundings, assess the potential hazards, and take the right precautions.
Like what?
Well, it could be anything from approaching the scene from upwind to making sure they're wearing the correct personal protective equipment.
PPE.
Yep, that's PPE. And speaking of PPE, the textbook mentions that the paramedics in our case study donned level B protection. So levels of protection, they refer to the different types of gear that paramedics wear based on what kind of hazards are present. And level B, that provides a high level of respiratory protection, but a little less skin protection.
So serious stuff.
Definitely.
Okay, so back to our patient in the case study. They found his pulse was rapid, but his blood pressure seemed normal. What does that tell us?
Well, a rapid pulse, that's a classic sign of distress. It means the body's trying to compensate for something.
Which in this case would be?
The effects of the chlorine gas, right. It's trying to get more oxygen to the tissues and organs that need it.
Makes sense. So what about the blood pressure then?
Blood pressure can be a little trickier. It can be influenced by so many things like the severity of the exposure, the person's age, any underlying health conditions they might have, even just their emotional state.
So it's not always a clear-cut indicator.
Right, and that's why it's so important to monitor those vital signs continuously in these situations. We need to see how the patient is responding over time, not just get one reading and call it a day.
The textbook also mentions the possibility of long-term effects from chlorine exposure. What are some things people should be aware of even after that initial incident is over?
Yeah, so even though many people do recover completely, some experience some lingering effects. Like there's this condition called reactive airways dysfunction syndrome, or RAS. Yeah. And essentially it's a lung condition that can develop after someone inhales irritants like chlorine gas. And it causes symptoms that are, they kind of mimic asthma.
Head east toward Ontario 6.
Things like wheezing, coughing.
Head
shortness of
northwest
breath,
toward
that
Ontario
feeling of
6.
Tightness in the chest. Imagine having a persistent cough, or just feeling like you can't quite catch your breath even weeks or months after the exposure.
Wow.
That's the reality for some people who develop RAs.
That sounds really debilitating. It really makes you realize that the